Thanks, Nick. If I start first, yeah. So I'm Amy Hawkins. I'm the head of adult services and tackling poverty in Swansea Council. Oh, I might have just frozen on the screen. Sorry. And I wanted to particularly reference how area coordination fits with our wider system transformation and our partnership working as well with health, and how it meets strategic outcomes that we're trying to achieve. As been mentioned already, area coordination does connect with people, communities, but also organisations as well, our service providers, our partner organisations in the third sector, our health board colleagues as well, and also with leaders of these organisations, with elected members, as Hayley's already referenced, but also community leaders as well, those formal and informal community leaders. And specialists as well, so whether that's welfare rights advisors, whether that's health professionals, they've got that reach across different partnerships. Really focusing on individuals has been mentioned already, but around those assets, both of those personal assets, that social value and those resources people have, but also those community assets in local areas as well. So I see that as really key. Strategically, it fits with our meeting our aspirations around delivery of Welsh Government objectives, a healthier Wales, a resilient Wales, Wales of cohesive communities. It really aligns with this, particularly within social care, Social Services and Wellbeing Act, the focus around prevention and early intervention. I'm trying not to say prevention a lot because we could say it a lot when we're talking about area coordination, but it's really key in terms of this work. It is central to it, but also providing that voice and control for individuals and focusing on their well-being. That what good looks like that John's referenced, the meaningful lives and fulfilled lives that Hayley mentioned as well. And it has co-production at its heart as well in terms of what we're doing. So we're really confident and comfortable of how it's helping us achieve the outcomes of the Wellbeing Act. Locally within Swansea, our Public Services Board wellbeing objectives and our corporate priority. We've got a corporate priority for tackling poverty and enabling communities, and it strategically fits very well with that. And we're a human rights city as well, and so the rights-based approaches, it's aligned very well. As mentioned already, but the area coordination we see as an absolute foundation or key aspect of our early health prevention and wellbeing offer. Particularly in this financially challenged times, I think it's, we see it is important to continue with this preventative approach and to engage with service users, carers, public communities as well. It is, as John's mentioned, it is part of a network of support, but it's one of the foundations for us in terms of our strategy. But it's particularly linking in with other partners within the council, but also third sector partners, health boards and communities themselves. It's a part of our regional partnership board approach as well. It's a part of the communities and older people's programme as well across the West Glamorgan footprint. And again, that links in with other partners for community connections, social prescribers, third sector wellbeing officers as well. So we know we're seeing an increase in complexities of individuals coming to us for care and support in social services. And we know that our continued focus on earlier interventions and independence and these networks of support only strengthen or help with the preventative agenda of supporting people so they are coming to us not in crisis or reduced crisis, as John's mentioned already. And the purpose is around the increase in the capacity and resilience of those individuals to decrease demand on formal services, and also the finances that are required as well. So we are seeing evidence of this. So just a couple of examples, but I'm very hopeful, and I'm sure Professor Joe Cook and Shana Gareth from Swansea University will also give some of the impact and the research that's been done around this as well. But we see locally the connections with communities that people are making, particularly around volunteering, training, employability, the links to our other support. We're seeing really excellent outcomes there. It's supporting people to live more independent lives. Particularly in a housing space, we work very closely with our registered social landlords. They're funding partners in area coordination as well. And we know it's helping avoid evictions and reducing costs to housing because of supporting people to manage their lives. From a safeguarding perspective, it's supporting our agenda around supporting with the safeguarding, but also reducing the amount of concerns that are coming in. We know people are less dependent on formal services like GPs through the involvement of area coordination or through their engagement. The prevention of crisis, as I mentioned already, but also it's the avoidance of referrals as well for coming into services. So area coordination fits with our service transformation. And as I said at the beginning, it's really central to our early help and prevention approach and trying to support people around non-service responses or reduced service responses. So I'll stop there and ask Dave if he wants to come in.
Yep, thanks, Amy. I'm Dave Howes, Director of Services in Swansea. I think there's a question and answer session at the end. Is there, Nick? Is that right? Have I understood that right? And I can see that there's questions already about funding and how does it work. Having heard what the other contributors have said at this stage, I'm not sure I want to say too much. That question about funding, how do you maintain investment in this? How do you get collective organisational intent around this, and then how do you hold faith if you can get that collective organisational intent and support around that? How do you stick with it, particularly as we face really difficult times periodically in public services, and we're just about to face, if we're not already in the middle of it, a fairly cataclysmic position in relation to public service funding. And it's an easy go-to, isn't it? Traditionally, an easy go-to. So, well, this is the stuff we don't have to do. We've got our core statutory responsibilities. We've got those core critical needs that we provide a safety net to in our population, and we're driven to do that. And that's the thing that's ultimately we'll get into trouble for. We won't necessarily get into trouble for not having an approach that's been described by colleagues around prevention, getting upstream of demand and remodelling, despite that we know both the logic of that and that actually is policy intent, both for our organisations, but also for Welsh Government and and beyond. There's an essential I can't think of the word for it. That challenge exists. We all know it exists, and that will exist for us locally and regionally as we look to work out how on earth are we going to carry on striving to be the best that we can be when resources are going to disappear before our eyes and we're going to have to make difficult choices. But I suppose the position that I say at this stage, and I'm sure we'll come back to it as the afternoon progresses, is that there isn't a service solution to the challenges that not a traditional service solution to the challenges that our population and that those most in need or most vulnerable, we're not going to be able to care and support our way out of that solution, out of that challenge is the reality of it. The truth is, as Director of Social Services in Swansea at the moment, I can't care and support my way out of the current challenges of the people knocking on our door. So there has to be an alternative to that. And everything that I've heard or directly experienced in whether it's talking with our coordinators, talking with other partners about what is going on in communities that our coordinators are a part of, or directly talking with individuals who have been introduced to a local area coordinator and listening to their stories, I've absolute confidence that this approach and the ethos, culture, the principles that are underpinning that are a far better stab at being the best that we can be for our population than some of our traditional service models ever could be. So when I'm thinking about further transformation, further improvement, how on earth are we going to mitigate the really difficult circumstances that we're going to face organisationally and that are then going to have repercussions for our populations. I would rather design around this and other things in this space with these sorts of underpinning principles, ideas, approaches to working with and in communities, than trying to go back to how am I going to find another 20 social workers or another 1,000 domiciliary care staff, or whatever it might be. We could talk across organisations, but I'll stick with social services. So that was probably the rambling bit at this stage, Nick. But I'm sure we'll come back to some more definite, questions and details, and particularly that issue, which would have been the first thing I'd have asked, around how on earth do you fund it? Where do you get the money from? How much does it cost? How do you hold the faith? I'm sure they'll come up in further conversations, but it'd be good to hear back from our university colleagues first, I suspect. Thanks, Nick.
Thanks, Dave. That was really, really helpful. I think that point about, starting small, thinking big, getting it going, protecting the integrity of it, learning as you go, doing that within a wider supportive community of practice. Really important. We're not proposing here, this is something that people have to completely overhaul the system in order to embed overnight. It's something about seeding it and then slowly growing it over time. And Swansea is such a fabulous example of where that's really happened and worked well.